Factors in action. Normal hemostasis. Hemostasis is a highly regulated process controlled by platelets, coagulation proteins, and elements of the blood vessel wall. When vascular injury occurs, blood loss must be minimized. Immediate local vasoconstriction is the first step in limiting blood loss. As the next step of primary hemostasis, platelets adhere within seconds at the site of injury to collagen and von Willebrand factor exposed on the subendothelial surface. This causes the platelets to become activated and form a platelet plug. In secondary hemostasis, coagulation is triggered by the interaction of tissue factor with activated factor VII, thereby generating a limited amount of thrombin, which activates platelets. Factor V to VIIa and factor VIII to VIIIa. Factor IXa binds to factor VIIIa, forming a stable complex on the platelet. This complex activates factor X to Xa. The activated factor X binds to factor VIIa on the surface of the platelet. Large amounts of prothrombin are then converted in a strong thrombin burst. Thrombin cleaves fibrinogen to form fibrin. In addition, thrombin activates factor XIII to XIIIa. Factor XIII protects the fibrin clot against premature fibrinolysis by both cross-linking fibrin molecules and incorporating the fibrinolysis inhibitor alpha-2 antiplasmin into the fibrin clot. The thrombin burst is of particular importance because it activates the platelets, converts fibrinogen to fibrin, activates a fibrinolysis inhibitor, and stabilizes the clot with activated factor XIII. Indications and usage. NovoSeven RT coagulation factor VIIa recombinant is a coagulation factor indicated for treatment of bleeding episodes and perioperative management in adults and children with hemophilia A or B with inhibitors, congenital factor VII F7 deficiency, and Glanzmann's thrombocythemia with refractoriness to platelet transfusions, with or without antibodies to platelets. Treatment of bleeding episodes and perioperative management in adults with acquired hemophilia. Important safety information. Warning: thrombosis. Serious arterial and venous thrombotic events following administration of NovoSeven RT have been reported. Discuss the risks and explain the signs and symptoms of thrombotic and thromboembolic events to patients who will receive NovoSeven RT. Monitor patients for signs or symptoms of activation of the coagulation system and for thrombosis. Please see additional important safety information at the end of this video. Please click above or see a Novo Nordisk representative for prescribing information. The following is a video depiction of the mode of action of NovoSeven RT for hemophilia with inhibitors, in which NovoSeven RT acts as a bypassing agent. Mode of action of coagulation factor VIIa recombinant. In hemophilia patients who have developed inhibitors against factor VIII or factor IX, NovoSeven RT, a recombinant version of human-activated factor VIIa, works directly at the site of vascular injury to stop bleeding. In pharmacological doses, NovoSeven RT not only adheres to tissue factor, it also binds to activated platelets, where it directly activates factor X to Xa. This is referred to as bypassing therapy. The activation of factor X creates a thrombin burst that promotes localized hemostasis, leading to the formation of a stable hemostatic clot resistant to premature fibrinolysis. NovoSeven RT provides rapid onset of action and allows for rapid bleed control. Rapid bleed control is limited to congenital hemophilia with inhibitors. Important safety information. Warnings and precautions. Serious arterial and venous thrombotic events have been reported in clinical trials and post-marketing surveillance. Patients with congenital hemophilia receiving concomitant treatment with APCCs, activated prothrombin complex concentrates, older patients, particularly with acquired hemophilia and receiving other hemostatic agents, and patients with a history of cardiac and vascular disease may have an increased risk of developing thrombotic events. Hypersensitivity reactions, including anaphylaxis, can occur with NovoSeven RT. Patients with a known hypersensitivity to mouse, hamster, or bovine proteins may be at a higher risk of hypersensitivity reactions. Discontinue infusion and administer appropriate treatment when hypersensitivity reactions occur. Factor VII deficient patients should be monitored for prothrombin time, PT, and Factor VII coagulant activity, F7C. If F7C fails to reach the expected level, or PT is not corrected, or bleeding is not controlled after treatment with the recommended doses, antibody formation may be suspected and analysis for antibodies should be performed. Laboratory coagulation parameters, PT/INR, APTT, F7C, have shown no direct correlation to achieving hemostasis. Adverse reactions. The most common and serious adverse reactions in clinical trials are thrombotic events. Thrombotic adverse reactions following the administration of NovoSeven RT in clinical trials occurred in 4% of patients with acquired hemophilia and 0.2% of bleeding episodes in patients with congenital hemophilia. Drug interactions. Thrombosis may occur if NovoSeven RT is administered concomitantly with coagulation factor 13. Please click above or see a Novo Nordisk representative for prescribing information.